We're now live. You can go ahead.
Ok, gracias. Buenas tardes a todos.
Good afternoon, everybody. Before we begin, we'd like to direct everybody who speaks English where they can listen to the presentation in English. So I'd like to say I'm Silvia Lemos. I'm a specialist of communications for the County of Sonoma. I'd like to give everybody the welcome for this Thursday, August 12th, that involves the education, the service, the public health services too. And our objective today is about the pandemic, the COVID pandemic, and how it's going to cover and affect the schools, our teachers, and our staffs, and what our students and parents should hope for as we open up the schools, so that we can help us to address your questions. We'll ask you to. We're going to be talking to Dr. Rachel Lemos Valenzuela. She's the superintendent of the school district, and then the Dr. Enrique Gonzalez Mendez. He's a very known doctor in this area. We also invited Delia Candenia, who is also going to share some statistics in regards to COVID in this area and in this community. They're going to take part in this presentation about where we are in this pandemic and how we have prepared our schools for our classes in this for this next year. You can ask the questions and just put them in the chat room, and we will get to your questions as soon as we can. And if you could do it on YouTube also, and we will begin our presentation like this. We would like to introduce to you Dr. Rachel Lemos Valenzuela, who represents the education services in the Sonoma County. Here she is. Oh, here we are. Here we are. I'm going to let you know how we're going to navigate this this year and the school year. The schools, we have so many. We have so many state laws that are state rules, state mandates that are being sent to us by the state and by the Department of Health, Public Health. And it is very important that the parents and the teachers know that the mandates can change just as the virus is changing. Also, the Office of Education for the Sonoma County, they have been working together with the experts in health and with the schools to adapt to the conditions that keep changing of the virus. We will try to take the best measures that we can as we go. We will try to keep everybody abreast as the changes come in and as the adjustments are being made. You can also get more information if you go to the website for the schools, schools to COVID. If you go to the website of COVID-19 California.gov, you can get more information about the measures and about the changes that are happening. Also, this winter, this fall, we're concentrating on the about our in-person learning. Our priority for the state is that all students should have access for instruction that is safe, that is full-time, and that the most time that that instruction can be happened for them, the better. And all the administrators and teachers have worked very hard during the summer to try to meet that goal. And so this information is very important so that everybody knows. Especially, first of all, everybody has to wear masks. We ask that everybody, indoors will have to be wearing masks inside all buildings in any campus that is a school or inside a school classroom. Also, you can also opt to use your mask outdoors if you'd like, but it's not mandatory. Now, about quarantine, if you use a mask, the kids that are exposed to COVID don't have to stay home. They can go to school unless they don't show any symptoms. If they show symptoms, then they have to stay home for at least 10 days after they've been exposed. Now, the instruction that is in person or in full-time is a big goal for us this year. So we will try to give instruction without the hybrid instruction like we did last year. The objective is that the kids return to school full-time. Some people ask, why do we have to use a mask? And so we have several reasons. That protects the kids that are not vaccinated, and it also it helps during the quarantine, and helps to have the full-time learning, and we don't have to have any social distancing. The parents asked us, what can we do to make sure that the kids have a good, successful year in the schools? And so here are some suggestions. We could try to get the kids to use their masks. We want to make sure that the kids are also tested regularly. So we try to help them to try to get them to get vaccinated, especially the 12 years and above. And also that all members in the family that live in the household that are also vaccinated, especially that we know that most of the kids that are usually getting more exposed to the virus at home than at school. In case that you have doubts that if he's got the virus, then you make sure that you do the testing or keep him at home. Another thing that you might need to know is about the independent studies. We know that some families that are not ready and that don't feel ready to that the kids could come to school in person. So we have an option or another requisite that the school districts have to offer an option, which is independent study for these families. If you want more information or are interested, you need to talk to your school or talk to your district to see what your options are, to see how this program is developed in your district. And it is also important that the families also, they can also option to participate or not participate in independent studies. Yeah, you cannot try it out for a little while to see if you like it, and then you decide later on that you don't want to do it. But if you want to do that, you need to talk to your principal of the school, and you need to find out about that. But I invite you that you talk to your district, that you talk to your principals, and talk about what is the best option for you, but where your kids are going to school. It is also important that this study, this independent study, is very different from what we used last year, which is what we used to call distance learning. Again, talk to your school to find out what the differences are. Now I'd like to send that over to Dr. Gonzalez Mendez so that he can give us a state of the situation with the pandemic here in the state of California. Hi, everyone. Well, thanks to everybody for Sylvia that she invited us to this event, and I appreciate it. And the idea here is to offer everyone here the best information. I'm a little stuck here. Hold on just a second. We're just want to remind everybody that after the session, there's going to be a question and answer time. So if you have a question or a comment to make, that you can also put it on your chat, and we'll address it after the session, after the presentation. Thank you for the superintendent that is giving us all this information. Thank you. I thank everyone for the invitation to be here to talk about the opening of the schools. It's always an honor to be able to talk to the community. The thing is that it's been 18 months that have been very tough on everybody, the students, teachers, administrators, people that in charge of the health departments and public health. We have worked very hard with Dr. Harrington to give you all the best information and the orientation as possible, so that the education office and the different districts, school districts could take the action necessary, right, to use the right protocols to be able to open safely our schools again. We are a little bit worried because of the recent rise in cases in the county, and it's something that is it's happening a lot because of the Delta variant, and it is happening more with the people that have not been vaccinated, are the ones that are actually being affected the most. So we want to make sure that we want to support our return to school in person, full time, while we also do our best to assure that teachers and parents are feeling comfortable and safe to be able to go back to school, and that the classes are safe. And in any other way, we probably could not be able to do this. So one of the things is for sure that the students are 12 and up, the best that you can do to be sure that is to get the vaccine. Like we're going to see in a few minutes in our statistics, right now the people that are being affected the most, almost 5 times more, have been people that have not been vaccinated than the people that have been vaccinated. Almost 80%, 8 of every 10 people of those people or those patients that are in the hospital, and more than 95% of those that are critically ill and in the ICU in our 6 hospitals in the county are people that had the opportunity to get the vaccine. The opportunity has been there for a long time. The vaccine is free, but for whatever reason, they decided not to do it. And it's very important to note that without worrying about the status of the vaccine in the departments of California, of the health departments in California, we asked that everybody who is like from kindergarten to the 12th grade, that everybody has to wear a mask. The governor also talked yesterday that the state is going to ask for a proof of a negative test for people who are not vaccinated. That means that every teacher that has not been vaccinated, the bus driver, anybody that is in the school will have to be testing with frequency, and has to have a negative result. It's something that's going to have to happen, And we appreciate that the governor has had the courage, because that's what we need to do. So we're going to start doing this from today and on, and we are giving people the time for people to decide to get the vaccine up to the 12th of October of this year. This makes sense because the vaccine and the face coverings are the best tools that can help us prevent the communication and the contamination of this variant and spreading the variant. We also have adopted an order of health order that also is with the masks in public places that are enclosed, also restaurants, theaters, large places where we need to go back to those measures that are a little extreme, because there's a lot of people that have not been vaccinated and are getting infected. And like I said, the mask is a good tool, but it does not substitute the vaccine. If you haven't had the vaccine, please do it. Get it done. For you, for your kids, for your family, for your community. Nothing's going to happen. No, you're not going to get sick. You're not going to get seriously sick. It's the best thing that we could do for the community. It's an emergency of a health emergency. And we are seeing some bad things, because people decide people are just resisting taking the vaccine. The thing is those a few people that are not being vaccinated are infecting other people. So beyond the mask and getting the vaccine, there's other protocols that some districts and some schools are going to be implementing, or that they could adopt to keep our teachers and our personnel and administrators safe and our kids safe. And we are going to talk about a few of those today. Our parents have a lot of questions in regards to kids going back to school. It's been a year and a half, and they want to know what's going to happen if there's an outbreak in the class. What's going to happen? Who's going to get quarantined? About the quarantine? These are parents that don't want to send the kids back to school if there's something like that. So we're going to try to answer those questions that you may have today. We have done extraordinary work in just trying to get everything ready, and we think we're still advancing, and we are still vaccinating people in our community, but there's still a lot to be done. At this moment, about 7 of every 10 people have been vaccinated, are completely vaccinated. That means the 2 vaccines. When they're about 8% of the people, there's still a lot of people waiting for the second vaccine because the first one doesn't work the same as if you get both of the vaccines. So that's very important to note for your protection and for the protection of your community. Also, I'm very happy to say that the people of large growth in the vaccine in the county are people that between 12 and 15 years old have responded great. Even though it's only been 3 months that the vaccine got authorized for them. And so in this group, we have had a great response. 46% of this group has been completely vaccinated, and almost 12% is partially vaccinated. People between 16 and 24, 59% has been completely vaccinated, still very low. And 10% has been partially vaccinated. So this is still, this is good because it shows that the kids in school are starting with a good protection for the virus, but it's also good that we can also get a message for the group, that's 12 years old and more, that they can also receive the vaccine. If you have not been vaccinated, or you haven't vaccinated your kids, please get it done. Just do it. You do it as soon as possible. You could do it this week and tomorrow. The vaccine is safe, it's effective, and it's free, most of all. So this is very good, and it's happening in a lot of places in the world. So please take advantage that we're in this country, that we have this opportunity, so that you and your family could be protected. We definitely, it is the best protection that we can offer against this, the worst that the virus has to offer. And we're seeing that some of the worst that the variant is doing, which is very aggressive, very contagious, is we're seeing some states in this country where there's no more room in the hospitals. And so they're running out of, they don't know what to do, what to do with the patients to get them all accommodated. And so the treatment that's going to save their lives. So unfortunately, these are places where the vaccine, people who've been vaccinated, where the rate is very low. So if the county continues to support the clinics that are giving the vaccine from the Department of Education and the different places and around all the schools all over the county. So to get a list of all the clinics, the free clinics, go to the website and you will get all that information. Anybody who has more than 12 years old is eligible, 12 years old or more. There's interpreters in Spanish. Just bring your ID with your photo and your maybe something that has your birth date on it, and just to check, make sure that you are fine. Just like if you have an ID, with Social Security, just bring something that IDs who you are, and then go ahead and get the vaccine. No one will be sent away. Another big advantage is to get vaccinated. The kids that are below, that are under 18 years old have to have a parent consent, or the parent has to be present with them because they are still considered minors. And so a lot of people want to know, when will the vaccine for kids under 12 years old will be available? And this is a very good question, but it's something that we have, we're all asking, and for everybody who has kids of that age. This speaks about how careful people are being about these vaccines, and this also speaks about how careful they are being about these vaccines, and if they're good or they're not good for everybody. Yeah, so and we're hoping to limit the second side effects that can happen. So right now they're doing trials on kids from 5 to 11 years old. So hopefully in about 2 to 3 months we will have word about that. So we are still waiting for those. So we're thinking that maybe by around December, we might have a word in regards to where we are on those vaccines that are going to affect the kids that are of underage. Not, hopefully not just for this country, but probably for the whole world. So right now there aren't any plans about having the vaccine available then. But I'd like to answer your questions about the vaccine. But at first I want to pass it on to Ms. Candela, who works with the county, so that she could show us more information that has a lot to do with the vaccine. So we will pass it on to her. Thank you, Dr. Gonzalez. Hola. Hi, thank you for having us, everybody here presenting. I'm going to be showing you some graphs and some information about where we're at on the pandemic here in this Sonoma County. These are the general tendencies in the Sonoma County. We are looking on our metrics that these statistics are about 2 days old. So we're looking at 19.5 cases new for every 100,000 residents in the county of Sonoma. That's about 8% of residents that are getting a positive test of the virus. And again, 10.9% also of positive cases in the fourth quarter, the lowest quarter. These are the areas where we see areas that are typically, these areas are where there are a little more areas that are more socioeconomically challenged. Also, hospitalizations for COVID-19 are about 71 actually in the hospitals, and 22 individuals that have passed away from COVID-19 in the last 2 months. This is information about the variant, like we've talked about the different variants. The one that we're following, the one that we're following the most is the Delta variant, which is probably the most dominant that has been detected here in Sonoma. 93% of all the cases in the country have to do with the Delta variant. The variant is very contagious and definitely has contributed to the number of cases that are in the hospital and that all the situation that we have here in the county. This graphic will show us a little bit in detail and related to the different the different races that are the ethnic and race that are affected the most from the pandemic. We see that the Latinx has been a very high affected one. Also American Indian and Alaskan Native, Afro-American, Black and African American. And the more affected ones have been the Latino group of people have had the most affected cases. So it's been 27.3% of the people here in the county. Thank you. In this graph here, you're gonna see a little bit about where we see the population that has not been vaccinated. The orange line is the cases of people that have not, these are the people that have not been vaccinated. We have 37.1 cases that are brand new for every 100,000 people per day. And also the blue line are the people that have been vaccinated. So we've only seen very few per day. So there's a big difference in cases. The people who have not been vaccinated. So the people who have not been vaccinated have been more affected. This is also a little bit about the hospitalizations and deaths that we've had in the county. 71 patients hospitalized with COVID-19. More than 15 of them have been in the ICU. More than 80% of the hospitalizations have, and 90% of the patients in the ICU have not been vaccinated. 99% of all the deaths that have happened have been from people who have not been vaccinated. These are also some graphs about the cases that we have seen in the different ages. In the last 60 days, we have been watching a rise in number of cases in all the groups. We've also seen cases that are at least more frequent in the kids that are more, the kids from between 20 to 39 years old, and also the 30 to 39, and then 40 to 49. But the biggest rise has been with people 20 to 29 years old. And also where we're going with the vaccine. So far we have 79% of the public have been people that are eligible. That means 12 years old and up, have been partially vaccinated. 71% of them have been fully vaccinated, and 8% of them have been partially vaccinated. That means they've received at least one dose of the vaccine. This explores a little bit about how we are in the different ages, how we're doing on vaccines with different ages. There's still a breach of people that are 34 and younger who have not been fully vaccinated, comparing to other groups that are an older age. 46% of the young people from 12 to 15 have been vaccinated, 59%. Of the 16 to 24 years old, 61% have been vaccinated, and 25 to 34 years old have been completely vaccinated. Basically, the areas here that are green are that have been partially, the dark green, those are the ones that are completely vaccinated, and the gray bars is the people who have not been vaccinated. So it gives you the areas of the kids, the ages that have not been vaccinated. So this graph here gives us a little bit of understanding about where we are, and also by ethnicity and by different groups, where we are on the vaccines also. So if we look at the graph, we'll see partially that on the green, people have been partially vaccinated, and the blue is the people that have been completely vaccinated, and the gray is the people who have not been vaccinated. So you can see by the ethnicity, people that have not, people who are identified like Latinos or multiracial, we are doing advances on that, and changes, it's changing per week about people who have been vaccinated and comparing, and we have gone up then between 930 and between the 26th of July and to the 2nd of August. And we have had a new number of 53,808 people who have been vaccinated. So that's a rise percentage of 8%. So we still need to do a little bit more. This is actually something that the county looks at, equality, which sectors of our county, what parts of the county that we are monitoring who is getting the vaccine. Actually, right now, 25% of the 2 doses of the vaccine have been given to residents in the quarter that it's the lowest HPI, and also on the residents that have access to the less resources. And 69% of the residents in this quarter also have menos, there's less people partially vaccinated, 8% partially, and 61% of them have been fully vaccinated. That was the last slide. Thank you for all the panelists who participated. So now we want to go to the next part, which is the answering question and answers. And we ask everybody who has questions. So we're going to see what whatever themes that people have, what kind of questions they want to ask, and want to make sure that everybody knows that we have some nurses online. We have Robin Haysher, who is, we also have an epidemiologist and also we have some people from the council of the county, and also from the different officials from the county, Sonoma County, that are here to answer the questions. If you have a question, and if you also speak English, you can also make your question and ask your question in English, and we will try to translate the question and the answer into Spanish too. So we're gonna see. The first question that we have is, how is the politics gonna be, or the policy about kids using the face coverings in class? Thank you for the question. The policy in school about the face mask is that everybody has to be using a face mask, and students, and also the people, the teachers, administrators, anybody that is working at the school, everybody, even the bus drivers, everybody who supervises the kids, even during the time of recess, or the people that provide food in the cafeteria, everybody has to wear a face mask, and that is the policy. That's also, it's a tool very useful to also to reduce the exposure to COVID. Does anybody else have anything else to add to that answer? If not, we'll go ahead with the next question. I'd like to add something. I also noticed that is it a requisite to use it inside, indoor, or outdoors? So I want to make sure that inside in the buildings you have to wear it, but we are encouraging people to use the mask outside, even though it's not a requisite, but we are encouraging people to use them outside also. What if a student is exposed? Is there quarantines for the kids?
Hi there, I can answer that question.
Sí, yo puedo contestar esa pregunta. Yeah, I can.
If a student is exposed at school and both the person who was infectious and the student who is the close contact are wearing masks, then the student, the close contact, can do a modified quarantine. This modified quarantine will allow the student to stay in school during their quarantine period for 10 days. And they have to get tested 2 times per week during that 10-day period. Sure.
Basically, if a student has a mask and has contact with a student, they're gonna have to have a modified quarantine. That means that in that case, the student they're gonna have to follow the protocols. The modified quarantine will be that the students that were using they can continue to be in school as long as they don't have any symptoms, but they're gonna have to continue with the use of their coverings, their face coverings. They also require that 2 times during the week, they have to get tested both times during the week. Thank you.
Yes, I would like to add to
Okay.
that if a child is exposed at school and they choose to do this modified quarantine option so that they can continue going to school, they will need to stay in quarantine while they're at home. So it doesn't mean they can do whatever they want to. They're just allowed to come to school, but while they're at home, they still need to stay at home. They can't go to the playground, go to people's houses. So it's a special exception to allow them to stay in school if they've been exposed. Oh, I have one more thing to add. The reason that we're able to offer the modified quarantine is because we feel very confident in the safety of kids wearing masks in school. We feel like if everybody is masked, the risk of exposure is so low that that's why we're able to offer that option to kids to be able to stay in school.
Paloma estaba explicándonos que la razón por la que nos sentimos seguros en sí es porque sabemos que el riesgo de mantener o de haber expuesto a alguien es mínima y se sienten, es algo de bajo riesgo. Doctor o Rachel, por favor, si hay algo que se me está escapando, especialmente si es información clínica, por favor, agregue, especialmente usted, doctor González.
Sí, gracias, Denia. Efectivamente.
Yes, thank you. Yes, the mask is one of the best methods that is more effective to prevent the infection of that's why we use it in surgery.
El niño que estuvo en contacto con alguien.
Yeah, then the kid was in contact with somebody who resulted that made him have a positive result, that he might have gotten the infection by having a face mask is very minimal. But if he has the face covering all the time, it's very important that I say we have to make sure that the masks are covering the mouth and the nose, and that they don't have large spaces on the sides where the air can come in that is contaminated. So we also know that as long as we clean the surfaces with detergents, antiseptics, or disinfectious materials is important, but it's not that important because most of the times the virus is transmitted in the air or through saliva. That's why having the mask is very fundamental. We also would like to add too, for the parents who are listening, that it's very important. This is one of the most important things about this modified quarantine, is that the reason that the kids are using the face coverings in the schools and inside the buildings and in the classroom, and hopefully outside when they're in the patio playing, this is the modified quarantine, but because we allow the kids to continue going to school with the face mask, their activities, they have to continue quarantining at home when they're at home. They cannot be going outside into the playground. So we appreciate everybody who are partaking in this, and that they're giving everybody all your opinion, and forgive us this information that you're giving us. Another question that we have is
¿quién hace esa determinación? No sé si doctora Valenzuela tiene información sobre eso. Y no sé si tiene respuesta porque no sé si esa decisión la va a hacer cada escuela o si es el supervisor.
Excuse me, I was coughing. They're asking if there's a cap in which the schools might come back and close the schools again completely. And so they would ask somebody to talk about this.
Jenny, ¿sí escuchaste la pregunta? ¿Te la puedo hacer en inglés?
Yes.
Jamie, did you hear the question?
Okay.
It's
In English,
about the
it
cap.
was, will schools close if case rates reach a certain threshold?
So we will not close an entire school if we do have a few cases here and there. However, if we have signs that transmission might be happening at school, so if there are 3 or more children who are all positive in the same classroom, we might have to close the classroom or just quarantine kids who were exposed by those children. If we reach, oh, sorry, you can do that part first if you'd like.
So, si solo son como 1 o 2 casos que son expuestos, entonces no van a cerrar la escuela o el salón, pero si ven que hay como 3 o 4 más casos en el salón, entonces puede ser que cierren ese salón solamente. ¿Es lo que escuché?
Yes.
Okay.
Okay, and then if there are many outbreaks at one school, say we have 5 classrooms that each have 5 or 6 cases, that might be a reason to believe that there is something going on at the school that is missed. Maybe they're not masking in the classrooms or
Okay.
something like that.
Ok, entonces si hay más brotes en otros salones, que vamos a decir que hay 5 o 6 salones que tienen más brotes, entonces quiere decir que puede haber una situación más, más impactada en la escuela, entonces van a tener que ver si necesitan cerrar la escuela o qué es el asunto para qué tomar, cuáles medidas tomar.
So in a situation like that, we might have to take a step back and see, do we have to close the school temporarily to get things under control? Maybe test everyone and see if we can have everyone do a quarantine who was exposed.
Entonces es cuando tienen que tomar el tiempo para revisar todos los casos en esa escuela y determinar si la van a cerrar y hacer pruebas y tratar de buscar cuáles otros casos se han expuesto. ¿Había otra información, Dania o Rachel?
Básicamente tenemos que reasesorar si es necesario cerrar temporalmente para asegurar que todos estén en cuarentena durante y reasesorar después también, parte del protocolo.
Pero también sabemos que la mejor cosa
We
que
also know that the best thing that we could do is also to prevent putting ourselves in that situation is we have to remember that the things that we have available are, we have the face masks for adults that are 12 and above. The best thing to do is for them to get vaccinated. Also, that would be the best thing. Yes. We also would like to remind all our parents that are listening to us that the quarantine is not something that was invented like 2 years ago. Quarantine was actually means 40, and it was invented about 500 years ago. Maybe it's in the Bible, but it was actually invented in Venetia when the bubonic plague was getting spread in Venetia. So they would not let the sailors come to Venetia to make sure that they were not coming, that they were bringing the bubonic plague into the land, into the mainland. So this has worked for a long time. So when we didn't have antibiotics or we didn't have other resources, that's all that they could do is put people in quarantine, the people that were sick. And so that's why we don't last now 40 days, right? But that's what we call it. And also another question, I don't know if you have the answer for this, Dr. Mendez, but if they want to know that you could explain to us what is the new variant, the Delta variant. Sure, with the virus are very smart, very intelligent. So that's why they reproduce very fast and they affect a lot of people. The virus will change, they will mutate to be able to tolerate the antibodies that are being produced against them. And so they also need to to mutate, they need to replicate themselves. And that's why the people who have not been vaccinated are the recipients in which the virus is replicated and it changes. and it changes to be able to resist the antibodies naturals of the body, but eventually to resist the vaccines that produces antibodies will not kill them. That's why it's important for people to get vaccinated. It's not that if I don't get vaccinated, nothing will happen to me. No, you could be the people, you could be the person where the mutation can happen and that where the virus gets stronger. So the Delta virus is a very violent. If you were to take a sample from your nose, from your nasal cavities, and you could see it from the initial COVID and the Delta, we find that 1,000 times more virus in one of the than one of the original coronaviruses. So this is we're waiting for this, just like Dr. Fauci said, that unfortunately there are variants that could be more violent, that virulent, but they could also resist the vaccines, and they might not be 100% effective. But this will only happen if the virus gets the chance to replicate, and the virus can replicate. The virus can replicate on people who have not been vaccinated. That's why we need the ones that are vaccinated. It won't happen there, but it will happen on people who have not been vaccinated. Thank you, doctor, for that. Another question that we have is there going to be a program of an independent study in Spanish? It all depends on the school in which your kids are going to. For example, in Windsor, the Calicamecal is an immersion school, bilingual. They're going to continue with the same studies because of the independent study, and at home, it's going to be connected or related to what is being taught in the classrooms at the school. And the reason why is because the kids can change from independent study to studies in person. And when they do that petition, and because they ask for that they want their kids to go back to school in person, the schools have 5 days to then make that change. And then it'll be necessary for them to have the program, the education program that's consistent about what is going on inside of the schools and what's being taught in independent studies. I want to remind all the parents that the independent study is it's a great possibility, and a good opportunity, but the people that are studying about this situation and that are watching this, that they're finding out that the kids that are not going to school, that they're having very serious problems more frequently of depression, anxiety, fear, etc. So kids, adolescents that were perfectly fine before, because of the socializing is part of the social. Being social is something that's part of being a human being. So yeah, it's fine if you decide that the kid is not ready to go back to school, but you need to you also estimate that your kid could also get sick, or that you might see that he might wake up in the middle of the night because he's having nightmares, and before he wasn't having nightmares. This is also worrying a lot of psychiatrists, and so you need to evaluate where your kid, where your son, where your daughter is. Well, if I keep her here, I'll protect her, right? But maybe your son or daughter could be having mental problems or issues, and so you really need to think about that and evaluate that. We only have about 3 to 4 minutes left, and so I wanted to ask one of the panelists if they could say something that they would like to share with the public in regards to COVID and the opening of the schools. Something that you would like to share with them. please. I would like everybody to, Denny, would you like to start? Yes, I think we have a big, a similar message, but if you are eligible, especially the students of 12 years and up, please go get vaccinated. That's the best tool that we have to be able to fight against this pandemic. And especially in the communities that have been the more affected ones, we have seen the impact that it's made. We've seen what's happening with the variant. And so it's very important that we take it under account that we have this tool so that we can be better protected and better for our kids in our community. Two things I'd like to say. First, parents, please ask questions about the directors and the teachers. What are the best things of options that are being offered to you? What measures are your schools having to ensure that that you could avoid getting the virus? And also the second thing is also you as parents be the examples and the models for your kids. Use the face coverings. Take care of yourselves. The things that places where you go, the things that you do when you go shopping, when you go to the park. Always wear your face covering so that your kids see that it's something that it's important to you, and then maybe they will model. They will try to do what you do. That they'll understand that it's also important, not just in school, but also at home. You're modeling and you're putting the example. That they will also see that it's very important at home just as much as it is in school. Maybe we can all contribute to help eliminate this this COVID virus.
La verdad es que yo he escuchado mucho que la gente.
The truth is that I've heard that people are afraid to get vaccinated because it's a vaccine, a new vaccine, and it was made kind of fast. No.
No es una vacuna nueva.
No, it's not a new vaccine. It's a vaccine that was made before. That's why it was already made. There was already things that were already made, and pharmaceuticals that was already begun. First of all, that's the first thing. Why do we need to? Why do we vaccinate our kids with other shots? You know, against polio, against the mumps, against other. And we don't ask any questions about that. But there's a lot of disinformation in the social media that is wrong, and I consider it criminal. And so I would say you need to get it done. You need to take it. I want to finish everybody. I want to thank everybody, all our invitees that were here and that spoke. And I also would like to help all of the people, Juan Morales, our Spanish interpreter, and also Vincent James, that was helping us with the sign language. We also want to remind everybody that this session was recorded, and it will be loaded up onto the internet and the Sonoma County website. So please share this video with your friends and with everybody so that they can receive this information, that it's so vital and important. And so thank you for we also ask everybody to go to SOCO, to vacuna, to receive more information about the vaccine, and to know more about the clinics that are out there that are available to get vaccinated, and also about the school openings also. We hope you have a great first week of school, and please take care of yourself.